Welcome to Horizons of Thought. I'm in sunny, hot, humid Singapore, and today I'm wearing a face mask to symbolize the fact that when I leave my house, I have to wear a face mask everywhere I go in this country, unlike New Zealand where people are rarely wearing face masks. I suspect that people in Singapore are going to be wearing face masks until the vaccine becomes prevalent. So today, I'm going to talk to you about vaccines and how people respond to them. I'm pro-vaccine. I can't hide that fact. And one of my favorite vaccines in human history is the measles vaccine. The data showed really early on that with the measles vaccine, when children got immunized against measles, they were also often much more immune to other childhood diseases. Nobody really understood why at the time. Measles vaccine just seemed to be super effective, not just against measles. They found out not that long ago why this happens. That's because measles makes your body forget its other immunities. So if you give people a measles vaccine, the body doesn't forget that it's immune to other things that it's already experienced, so it makes it less likely for children to get measles. So to me, the measles vaccine is absolutely great because it prevents you from having to buy cute multicolored coffins for your babies and toddlers, which I don't think anybody really wants to be doing. So, absolutely love this vaccine. But I do have to say, not all vaccines are equal. I also took the flu vaccine this year. Now, in New Zealand, there's pretty much no such thing as a flu anyway, so I wasn't likely to get the flu. But even in places where flus are still around, the flu vaccine, according to the CDC, really only reduced the likelihood that you would get a flu from between 40 and 60%. It pretty much cut it in half. That's not nothing. It's helpful, but it's not the greatest vaccine in the world. And the reason for that is not because there's anything wrong with the particular vaccine. It's just that there are lots of kinds of flus that float around, and your vaccine only covers a couple of them. So there's a real chance that you'll get a different strain than the kind that's floating around. And that's why the flu vaccine is not 100% effective. Now, having said that, there are lots of people in the world who are hesitant about vaccines for various reasons, or they're simply opposed to vaccines. They don't believe what I said about measles, they don't believe vaccines are effective, and they think that there's a lot of dangers associated with them. That history, that's not new. There's this word that we use. If you watch the movie Hacksaw Ridge, you've heard it before. It's called conscientious objector. You think of the term conscientious objector as somebody who refuses to carry a gun into combat and kill other people. They've thought about what it means to serve in a war. They don't want to be a murderer, and they choose not to carry a gun into battle. But that's not where the word came from. The word conscientious objector actually came from the very beginnings of the smallpox vaccines, where there would be two kinds of people who didn't get vaccinated. One kind of person would be the person who didn't know about the vaccine or didn't have a chance to get out there. They just didn't get the vaccine because they didn't get it. They didn't think about it one way or the other. They just didn't get it. The other kind is the person who had the opportunity to get this vaccine, and they decided, nope, I don't want this vaccine for moral or scientific or ideological reasons. These people chose, by virtue of their conscience, to not get vaccines, and they were then called conscientious objectors. That's where that comes from. Part of this came out of the fact that the smallpox vaccine was a very rough, very difficult vaccine. It makes you itchy, it could cause very difficult side effects, and because of that, early on in vaccine research, scientists developed the 100-to-1 rule, which is that a vaccine's really not going to be released to market unless it benefits 100 people for every one person that it causes harm to. And that's the principle under which vaccines are released to the public. But it is important to know that it doesn't always stay that way. So for instance, at the beginning of the polio vaccine, there was lots of polio around. You take this vaccine, it's a live oral polio vaccine. It had a small risk of creating its own infection and a really large benefit of making you immune to all the polio around you. But now that there's almost no polio left, there were cases in Japan where the live oral polio vaccine was actually giving more people polio than it was stopping polio from infecting them in the wild. And that's why we've actually had changes to the polio vaccine to restore the 100-to-1 rule, to keep on making it safe. Sometimes, however, these rules don't even work out. There are cases, for instance, called the Antivaxxer controversy in the Philippines, where governments rushed ahead of the science. They weren't really ready to make this vaccine roll out safely and follow the 100-to-1 rule. They didn't really prepare properly, and they ended up with a situation where the scientists quickly realized that this vaccine was actually hurting more people than it helped. And they estimated when they gave this vaccine to children that they caused the death of an extra 600 children compared to if they hadn't used this vaccine at all. So there are places where the science can get rushed and people get spooked out by this. That's something you got to deal with, and that's something you got to pay attention to. Now, that's one of the kinds of objections that anti-vaxxers have about this. How do we know that a vaccine is safe? Another kind of objection that you'll meet anti-vaxxers talk about is that early vaccines have kind of gross histories. A lot of the early vaccines that we had were cultivated from fetal cell tissue. Basically, abortions from the 30s and 40s were harvested for cells, and those cells were used to grow vaccines. And we still use cultures based on all those really decade-old cells for several kinds of vaccines. It's now gotten to the point, though, it's so far back into the past that even the Vatican has made the argument, you are not participating in these old abortions if you're taking this vaccine. It's just too far removed in the past. Nobody who's involved in making vaccines from these cultures today had anything to do with the original demise of, unborn infants that were used for those vaccine cultures. And I've got a link for this and all the other stuff I'm saying below. There's another kind of objection that you'll meet from people who object to vaccines too. And that isn't that they object to vaccines, they object to the timing of them. We often in North America give vaccines to children at very young ages. And in Europe, they'll give the vaccines a little bit later. So you'll actually see in many countries and different jurisdictions, different ages in which vaccines are given. And it is not the same, to object to the earliness of a date of vaccine as it is to object to a vaccine entirely. But sometimes these people get lumped together with anti-vaxxers. Anti-vaxxers have often had issues with other ingredients, not just fetal cells, in vaccines. These include things like mercury that's been used in vaccine as a preservative. These particular preservatives were well designed and they were generally safe for people, but it is true that we are now developing safer versions of preservatives for vaccines. And as time goes on, vaccines are not being preserved necessarily with mercury, but with newer and safer products. And certainly with products that are seen as safer. You will also meet people who would not normally be anti-vaxxers, but who are concerned about this upcoming COVID-19 vaccine. The reason why they're concerned with this vaccine is because there hasn't been the kind of time you normally have with vaccines for long-term testing, and also because this vaccine works in a different way than normal. Normally for vaccines, what happens is you're given either a dead or a weakened version of viruses. These come into your body. They have the proteins and surfaces of the viruses that you need immunity to. Your immune system encounters them. It figures out what's going on and it builds antibodies to fight these viruses, and this is how you become immune to them. The COVID-19 vaccine, on the other hand, is using something called messenger RNA. So instead of using proteins from SARS-CoV-2 virus, instead of using proteins from the SARS-CoV-2 virus, this is giving your body a messenger ribonucleic acid. This chemical is used to make new proteins in your body. It makes proteins that look like the contents of the COVID-19 virus. Your body then encounters these things, makes antibodies to them, and as a result, you gain immunity to COVID-19. And one of the reasons they're going to be doing things like this with this particular vaccine is because COVID-19 spreads much faster than many other diseases. So they're not particularly interested in injecting you with live or even weakened versions of the virus because it has a real chance of spreading in your body before you get immunization. This way, that doesn't happen. Having said that, this is different. This is not injecting a dead or weakened virus into your body. It's actually making your body actively make proteins associated with that virus. That means that there's aspects of this vaccine that have never been tested in humans before, long term. And we don't have the long-term testing because we haven't had a long term. This vaccine has been made inside of 1 year. So there are unknown risks that we cannot calculate associated with this vaccine, which makes some people nervous. So now that I've given you a bit of a list of the reasons why people might be hesitant about vaccines or anti-vaccine, the lesson I want you to take from this is when you meet somebody who says that they're opposed to vaccines or that they're worried about a vaccine, do not assume that they're an idiot. Do not assume that you should be talking down to them or that they don't understand the science. It's possible that they understand the science better than you do. What you want to do instead is be kind, listen to people, acknowledge their fears. You may have those fears yourself. Talk to them reasonably, listen, and give your own counterarguments. I've done this many times. My number one counterargument is, I've now been wearing this mask for about 11 minutes and I can't stand it. It's a good mask that doesn't fog up glasses easily, but if you look closely in the video, you'll see my glasses have fogged up a couple of times. It is just about the best mask on the market, and I'm still running into these problems. I'm in Singapore right now, and I have to walk around in the hot and humidity. My eyes are fogged up all the time. It is, I'm sorry, harder to breathe in this mask than it is without the mask because the humidity congregates around my face. I don't enjoy the experience of wearing a mask in this country. It makes me want to do hard exercise and sweat because then I'm not required to wear the mask by law. I can go off into the woods and do that. Or it makes me want to sit down in a coffee shop and drink coffee because you're not required by law to wear the mask while you're eating or drinking. That's kind of my response. Otherwise, I just want to stay at home while I'm here. I can't wait for vaccines to spread around. I want to be able to walk free and not have to be hidden and anonymous all the time, to be able to be seen in public. I want the health risk removed. This particular disease, while it's not, as I've mentioned before, super dangerous to any individual who's young and healthy, because it spreads so much faster than other diseases, it poses a huge risk, especially to the healthcare worker community. And it would be nice to have vaccines that mitigates against this risk and just allow COVID XX years to become a standard endemic disease like a cold or a flu that we encounter, we get shots and vaccines for, and we don't worry too much about. That would be a big improvement. I'm also excited for this vaccine because it's a new kind of vaccine and a new way of doing things, and we may find a dramatic improvement in all the vaccines that we have in our world as a result of the COVID-19 vaccine. We've got a lot of new space for medical research. Now, there's even some kind of creepy but cool things associated with this. This particular vaccine gets us closer to being able to manipulate the proteins and the DNAs inside of our body, which are going to have all sorts of benefits and risks and moral and social harms for our society. And it will be very fascinating to watch how humans deal with that. So I'm quite interested in seeing what's going to happen with this vaccine. And I'm quite interested, as you know on this channel, in encouraging people to treat each other with respect and treat each other kindly, so that if you're a person who disagrees with me on vaccines, I'm not cruel or mean to you, and I've encouraged other people to not be cruel or mean to you, but to actually listen to you and to pay attention to your concerns. And with that, if you enjoyed this episode, hit like. If you didn't enjoy this episode, hit dislike and tell me why. If you want to support this channel, hit subscribe. If you really want to support this channel, go down to the donor box, hit the link, and you can provide monthly subscriptions to this channel. Thank you very much, and I hope to see you in a couple of weeks.